Jaundice and phototherapy. Jaundice is common amongst many newborn babies. Let's address some commonly asked questions about jaundice. What is jaundice? We say a baby has jaundice when the skin and whites of the eyes appear yellow. Why does jaundice occur? Jaundice is caused by a build-up of a protein called bilirubin in the blood. Bilirubin can build up in the blood in the first few days of your baby's life. This build-up causes the yellow colour in the baby's skin and eyes. Jaundice is very common. It occurs in at least 60 to 80% of babies and is usually nothing to worry about. How is jaundice diagnosed? Jaundice is initially diagnosed after noticing a yellow appearance in the baby's skin and eyes. If you think your baby is looking jaundiced, they should be reviewed by your doctor or midwife. The doctor or midwife can use a machine to check your baby's bilirubin levels through the skin. This test is very quick and will not hurt or distress your baby. If the test shows that your baby's bilirubin levels are high, the doctor or midwife do a follow-up test by collecting a small sample of blood from your baby's heel. This will help to decide if your baby needs to be treated. Will my baby's jaundice need to be treated? Depending on how severe the jaundice is, your baby might need to be treated. Most types of jaundice are common with newborns. It usually starts in the first few days after birth and passes within 2 weeks. Sometimes there are medical conditions that cause jaundice in babies, such as a difference in blood group between a baby and its mother's blood. This type of jaundice can occur from birth and can take a month or 2 to pass. Your medical team will tell you what has caused your baby's jaundice and how severe it is. Both types of jaundice are treated in the same way, but jaundice caused by a medical condition may need closer monitoring. In more severe cases, jaundice can cause sleepiness, poor feeding, irritability, and in a small number of cases, damage to the developing brain. How is jaundice treated? Jaundice is monitored and occasionally treated with a light therapy known as phototherapy. A blood test will show if and how much phototherapy is needed to treat the jaundice. If the bilirubin level is mildly elevated, your baby may be able to be treated at home. If the level is moderately elevated, your baby may need to be admitted to the nursery for more intense phototherapy. Phototherapy is usually given for 1 to 2 days. It is normal for the bilirubin level to rise slightly after treatment is stopped. This will be monitored through blood tests. Phototherapy works very well to help babies bring down the level of bilirubin. The excess bilirubin eventually comes out in their poo. You can help this by making sure your baby stays well hydrated with regular milk feeding. Home phototherapy. Your doctor may prescribe home phototherapy to treat your baby's jaundice. This video will show you how to safely use a phototherapy unit at home. You will be loaned a phototherapy light pad attached to a fibre optic cable, a motor box, disposable covers to go over the phototherapy light pad, and an electrical power lead. To set up your home phototherapy unit, first insert the fibre optic light cable into the front of the motor box. This should simply click into place. Then, plug the power lead into a power point and turn on the motor. There is usually a black button on the front of the motor box. Next, place the phototherapy light pad into the disposable cover. Make sure your baby is dressed in a nappy only and place them on the illuminated side of the phototherapy light pad. Place your baby on the phototherapy pad into the cot or bassinet, lying them on their back. You can cover them with a blanket to keep warm. Safe sleep guidelines need to be followed. You can check with your nurse or midwife for more information. Keep your baby on the phototherapy pad as much as possible. You can breastfeed or bottle feed your baby when they are on the light pad. Keep a record of how often your baby has wet and dirty nappies, how often your baby feeds, how much baby takes at a feed, or how long they feed at the breast. If at any time you are concerned with excessive sleeping or poor feeding with your baby, please seek medical support.